Namaste, Suprabhatam. Welcome to Brahma Muhurat Yoga. Namaste, Suprabhatam. Welcome to Brahma Muhurat Yoga. If you are able to see me or hear me, please let us know. Yes, it has reached. Namaste, Pranam. तो चलिए अब आज का अभ्यास हम शुरू करते हैं. वी आर लाइव ऑन फेसबुक ऑल्सो. I have to I have to adjust the privacy settings of it. Edit audience. And if you are friends with me on Facebook, it will appear on your wall also. Once you go to my profile, you will get. Right now it is there. We are live on Facebook as well. Okay. Suprabhatam, Jai Shri Krishna, Suprabhatam. सुप्रभातम सुप्रभातम. ब्रह्म मुहूर्त योग में आप सभी का स्वागत है. तो चलिए आज का अभ्यास शुरू करते हैं. प्रणाम, जय श्री कृष्ण, सुप्रभातम, गोविंदा, हरे कृष्णा, शुभोदयम. चलिए आज का अभ्यास ये है. द टुडे सेशन इज ऑल अबाउट योगा फॉर बिगिनर्स, सूक्ष्म व्यायाम. And then we will discuss a bit about posterior circulation, stroke. Yesterday we discussed about the stroke which happens due to clogging of the carotid artery, and the cerebral circulation we understood. We understood there is a front stroke, there is a back stroke. Means front is anterior circulation, back is posterior circulation. Okay, so today we will discuss about posterior circulation stroke. Before that, we will enjoy doing Sukshma Vyayam as a beginner. Okay? तो चलिए आज का अभ्यास हम शुरू करेंगे. Back erect, neck erect, eyes closed, gentle smile on your face. Forget all the tensions and worries and focus only on your breathing. When we inhale, the abdomen is bulging. When we exhale, the abdomen is sinking down. With each breath, we are becoming more and more relaxed. Slowly, let us move our concentration to the tip of the index fingers and thumbs, which on touching each other feel the nadi kampan. Slowly, while feeling the pulse, let us move on to nostrils. When we inhale, cool air is going inside. When we exhale, warm air is gushing out. With each breath, we are becoming more and more relaxed. Slowly, let us move our concentration to the center of the eyebrows. Let us visualize one Omkara of any size, of any shape, of any bright color. While focusing on this Omkar, we are going to chant it 3 times. Feel the effect of Pranava Omkar on your mind and body. Slowly, let us move on to meditating on Mother Earth in the form of a globe. Slowly, let us visualize that there is a cosmic energy which is white, sparkling, flowing like a river, and which is entering the Mother Earth's atmosphere, cleaning it, clearing it. We all are visualizing the same thing. Slowly, this beautiful cosmic energy is coming to us also, and it is entering through the top of our head and illuminating our body as well in the form of like a Prakasha Punya. Slowly, because of this, our whole body is filled with cosmic energy. Each and every cell is vibrating positively because of this cosmic energy. We all have developed Sadbuddhi. We all have developed the motivation to do Satkarma. We all have developed the power to do Satkarma. And with that, we all have developed the knowledge for self-realization. This beautiful understanding, we all realize that we all are one in the form of matter as well as spirit or energy. And that helps all of us to improve our collective consciousness. Today, I am going to give you a homework because I want to discuss this topic on this platform. And I want all of you to try to read on your own, because if I tell something, you will listen and then you will forget. So instead of doing that, let us do it the school way, where school teacher will tell, no, you come read this chapter and come, then I will teach. So I request all of you to go and read something called as polyvagal therapy or polyvagal theory. Polyvagal theory. Okay, I have written here. Please read it. Okay, please read it, and then let us see. Tomorrow we will discuss, maybe tomorrow we will discuss about polyvagal theory and how it is relevant to current situation of the world. Okay, so that is what is my intention. Let more and more people understand the science behind the collective consciousness. Okay, now gently let us all of us together adopt Namaskara Mudra. Omkar followed by Sahana Vavatu. Om. Sahana Vavatu. Sahanau Bhunaktu. Sahaviryam Karavavahai. Tejasvinavadhitamastu ma vidvishavahai. Om Shanti, Shanti, Shanti. With your eyes closed, slowly take your both the hands back. Hold your right wrist with the left palm. Inhale, arch your back, look up. Exhale, bend from the root of the back, touch your
Your forehead to the ground. Express gratitude to Mother Earth, Almighty, your parents and Guru.
slowly inhale and come up. Slowly release your hands with few blinks. You may open your eyes. Suprabhatam. Om, Golconda. So I think he is from Golconda, Anil Chavan. Om Namah Shivaya, Suprabhatam, Namaste, Suprabhatam, Suprabhatam. Once again, welcome. Now we will do Sukshma Vyayam. Okay, so let us start doing Sukshma Vyayam. Okay, so let us sit comfortably, focus on the toes, pull the toes towards you, push down, inhale, pull, exhale, push. Today is beginner friendly session, so we are going to understand joint movements and execute these joint movements with respect to breathing. Okay, inhale, pull, exhale, push. Inhale, pull, exhale, push. Slowly try to pull the feet completely together with inhalation. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Slowly rotate the ankles clockwise and then anti-clockwise. 2, 3, 4, 5. Reverse. 1, 2, 3, 4, and then 5. Slowly play with your kneecaps gently. You can slide them, you can feel the movement up and down. Slowly, you can feel the movement sideways. You can rotate also gently. It's not about pulling and pushing in a very uh, harmful or hazardous way. It's about just enjoying that soft, gentle movement of the kneecap. Okay. Now, after that, tighten your kneecap. So these muscles will be tightened. Pull them, tighten them. Exhale. Inhale, pull and tighten. Exhale. Pull. Exhale. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Now, gently fold your left leg and bring it on the right thigh. Okay, just keep it like that and try to keep the knee down. Okay, just keep it like that, just like that. You keep it for a while with normal breathing. Now inhale and bring the left. Exhale. Now inhale, take your both the hands up and try to allow forward bending. Try to allow forward bending. Okay. Okay. Inhale. Come on. Exhale. How much ever you can forward bend, that much you bend. With this, what it will do is it will press your tummy against the ankle. Okay. On the right side, it will start pressing. Okay. Inhale. Come up. Exhale. Go down. Inhale, come up. Exhale, release and relax. Slowly inhale and exhale. Fold your right leg like this. And then keep it as down as possible. And if you are along the wall, it will give you a better level of alignment to go through. Inhale. And then exhale. What we are supposed to do is we are supposed to feel that pressure because of ankle, because of heel. We are supposed to feel the pressure on the abdomen on the left side. Okay. Slowly inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Release. And keep the right leg like this only. And then hold the left leg also to prepare for Titliasana. Prepare for Titliasana. Now, back is completely erect. Here, we are going to do 50 rounds of butterfly. You can keep it as close to the body as possible. Now, 10 rounds only on the right side. 10 rounds only on the left side. Now, one right side, one left side, like that. If possible, try to bend forward. Now, many a times I have spoken about keeping the front of the body stretched and then going forward. That will help you to keep the spine straight, and your bending forward technique also will improve. Instead of buckling, what you should do is keep the front of the body stretched like this, looking up, and then keep it stretched nicely, and then forward like this. Okay, so enjoy the stretch. Slowly inhale and come up. Now a very strong movement we will do. That movement is from the squat, that is Malasana, to complete stretch of the full body, that is Urdhva Hasta Tadasana. This body movement is very simple, but it is highly effective in improving our overall status of body and mind. Okay, so gently I am converting this Titli Asana into Malasana. Very initial phase of Malasana. I have shown you many a number of times how Malasana can be made difficult. Okay, so inhale, keep the spine straight, and then on exhalation, straight, shoot your body straight up and tighten all the muscles of the body, including the hands, which will become straight like this. Okay, so inhale, and then now exhale. Inhale, come down. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Now release and relax. Next, we are going to do in standing position. We are going to do Tiryaka Tadasana. Namaste. I am in school. I again very inspiring memory of school coming. Namaste. Jai Shri Krishna. Okay. Let us do Tiryaka Tadasana. You can keep legs together, or you can keep some 15-20 centimeter distance between the legs. Interlock your fingers. Touch your thumbs against each other. Inhale. Stretch nicely, and then exhale towards right. Look through your axilla. Look through your armpit towards the right. Inhale, come back. Exhale towards left. Inhale. Exhale. 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 Release and relax. Now, we are going to do side bending. You can increase a bit of distance between the legs, 3 to 4 feet. And then inhale and take your hands up like this. And then exhale. Inhale, come up. Exhale, only side bending. Inhale, exhale. No forward bending. Inhale, exhale. Inhale, exhale. Not necessary to go completely down. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale, release and relax. Now we will do bending and twisting together. Okay, how to do it means we are doing precursor to Parivritta Trikonasana. Inhale, exhale, bend forward. Further exhale, twist. So this is how it will be. Inhale, exhale. Inhale, exhale. Completely inhale and come up. Release, relax. So this was bending and twisting. Okay. Now this practice which I'm going to show you, it may feel a bit difficult. And for that, what you should do is you should take a support and do it if possible. Na hatha kavalat, a bit for youngsters. Okay. If you feel you are comfortable, then you do. Not necessary to do. It's not a compulsory practice. Okay. Keep the distance between the legs. Okay. Keep on between the legs. Okay. And then inhale, exhale. Now with inhalation, go to one side like this. Okay. I don't need actually support, but I'm just showing you that you can take a support and then inhale and then exhale. Inhale like this. Exhale. Inhale. I will remove the chair now. Exhale. Inhale. Exhale. Okay. Just a second. I'll remove the chair and show you what's going on. Inhale. See what is going on. This leg will become straight. This ankle has to completely come down. Okay. Inhale, then exhale. Stand up. Inhale, completely down. Stretch. And then exhale. Like that. So like that, you can do few rounds. You can keep hands like that. You can hold any object. You can hold somebody else so that both of you can hold each other and can do this practice. Okay. You can keep your hands up also. This is for strength building. Okay. In addition to the thighs, full body strength building it. Okay. Now, once again, we will sit and practice. And okay. If you have any questions, any queries, any doubts, you can ask. Mayurvkaku on that page. Mayurvkaku profile it is. See here. Legs are together. Back is erect. Left side of the body straight. Dandasana. Just smile. Now, inhale and exhale. Hold your right. As a beginner, you may not be able to do this. Inhale and exhale. Left leg. Then what to do? Do it up to your comfort level. Okay. But final position that there should be distance between knees, one forearm distance between knee and the wrist. Again, one forearm. On the palms. Inhale. See. Squeeze your hips, squeeze your abdomen in. Inhale. Exhale. Exhale. It is not about just movement. It is about awareness. Inhale. Inhale. Exhale. Inhale. Go up. Slowly release. And chin. Slowly from Shashankasana, one side to Bhujangasana. Keep the hands nicely, strongly floor, and with inhalation, go and form a bhujanga. Cobra Pose. Inhale. Stretch. The knees are on the ground. This very beautiful movement which we can do will lead us to a lot of strength and flexibility. Very simple yet very effective. Inhale. Inhale. Exhale. As a beginner, you should be focused towards synchronizing breathing. Inhale. Release and relax completely into Makarasana. This is called as center, right hand on the shoulder, left hand on the right shoulder. Deeply relax. Surrender to the breath. Slowly turn towards it and come out of this relaxed pose. Head up on your back. Now, next practice is legs in this position. Slightly dynamic. Okay. Just paddle as you might be paddling. Correct. And then slowly start increasing the range of motion. Normal breathing, you paddle as big as paddle like your cycle paddles are becoming bigger and bigger, like that you have to feel and paddle. Now slow down, small down, and then stop. Now we are going to paddle reverse manner. Means we were paddling forward. Now we are going to paddle backward. Do it at a smaller scale. Okay. And then slowly start paddling backwards with lot of increase in the size of the paddles. See the difference of approach. bigger and bigger. Slowly come down, decrease the size of paddling, decrease it, and slowly stop. Release and relax. If you do this paddling properly, then you will see that this extra tires which you have, Apollo MRF tires, they will get flattened out. Okay? Release and relax. Massage your tummy 2 times clockwise, 2 times anti-clockwise. Slowly release and relax. You can relax in something called as Supta Baddha Konasana. That also gives a lot of realignment process to hips like this, to our spine, and then finally to our shoulders. And to make your breathe out as longer as possible and as slower as possible. After sufficient relaxation, just release the legs without lifting the knees. Just release them and then slowly wiggle your toes, wiggle your fingers, bring the legs together, fold your left leg, straighten the right hand, turn towards right, straighten the left leg, keep the left hand along the left thigh, feel the linear stretch along the left side, and with the support of both the hands, come to sitting position. Okay, now we are going to do Prana Mudra, and in that Prana Mudra, we will practice 1:2 breathing. Now, this 1:2 breathing, I request all of you to count again I want all of you to count, and later on you can mention in the comment section. Enjoyed cycling. Very nice. Excellent. So what you have to do is you have to count 1:2 breathing. As a beginner, you should maintain a log. Always, we should all maintain our logs. What we should do is we are going to do it for 2 minutes along with our Prana Mudra. Okay. Prana Mudra, all of us know that it is Anamika and Kanishta joining here like this. You can see Anamika and Kanishta like this. Now, pressing here, we will feel the pulse. While feeling the pulse, what we are going to do? We are going to do 1:2 breathing. That is, if we inhale for 3 seconds, we exhale for 6 seconds. Okay. And I have a time over here which will let me count for 2 minutes. Okay. And I will see how much I have done breathing. Inhale and exhale is one breath. Okay. So let us start it. So I did 6 breaths, 1:2 in 2 minutes. So it will be in 1 minute, it will be 3 breaths. How was your experience? After this, we will do Prarthana, Sarve Bhavantu Sukhina, and after that, we will discuss about posterior circulation stroke. Adopt Namaskara Mudra. Om. सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्तिः शान्तिः Shanti. Your eyes closed. Slowly take your both the hands back. Hold your right wrist with the left palm. Inhale, arch your back up. Exhale, bend from the root of the back.
Touch your forehead to the ground. Express gratitude to Mother Earth Almighty, your parents and Guru. Slowly inhale and come up.
Slowly release your hands. Rub your palms against each other to generate heat or positive energy. Keep them over your eyes. Keep them over your head, neck, shoulder, arms, forearms, chest. With few blinks, you may open your eyes. Dhanyavad. Thank you very much. Now we will discuss about polyvagal. We will discuss posterior circulation stroke. Tomorrow we will discuss polyvagal theory. Okay. I'm going to share the screen. There are 31 people watching right now. So thank you very much for joining in. I request all of you that you just watch this. So as you can see, we have taken a sankalpa of 1 crore people joining together and doing this practice. And why this number is important and why we have to do the practice together, that we will be able to understand through polyvagal theory tomorrow. So you please try to understand what is polyvagal theory on your own today, so that it will be very easy for me to explain tomorrow. So now you are here, you can see this is internal carotid artery, which is anterior circulation. This is vertebral artery, which continues as basilar artery, fuses, and then we have this vertebrovascular circulation. So occlusion of posterior cerebral artery may lead to a thalamic syndrome with contralateral hemisensory loss. So half of the body will have sensory disturbance, followed by development of spontaneous pain and hyperpathia. So this is very dramatic actually. The vertebrobasilar circulation is very dramatic. As we read on, you will come to know. Then there is a macular sparing homonymous hemianopia, means half of the visual field will be gone. That is called as homonymous hemianopia, and a mild, usually temporary hemiparesis. So hemiparesis will be temporary. It will improve on its own over a period of time. Depending on the site of the lesion, the collateral circulation, the severity of these deficits vary, and other deficits may also occur, including involuntary movements. They will keep on having shaking of the hands or legs, and alexia. So occlusion of the main artery beyond the origin of its penetrating branches may lead to solely macular sparing hemianopia. Hemianopia means visual loss. Alexia means inability to read and write. Agraphia means write. Alexia means read. Okay. So vertebral artery occlusion below the origin of anterior spinal and posterior inferior cerebellar artery may clinically be silent, because the circulation, as we learned yesterday, that there is availability of collateral circulation through circle of Willis. Okay, so these kind of arrangements are there, but sometimes if it is congenitally small or severely atherosclerotic blocked, then this good collateral circulation may go away, and then we may find strokes of different kinds. Okay, obstruction of pica, posterior cerebellar artery, which we call it as pica, or obstruction of vertebral artery, just before it branches, these vessels lead to lateral medullary syndrome, chakkar, vertigo, nystagmus, sensory loss involving face, and then limb ataxia, difficulty to maintain balance. Horner syndrome means eye will be drooping and one eye will be closed like that, combined with contralateral spinothalamic sensory loss, means You are not able to feel sensations on the one side. Occlusion arteries or basilar artery leads to coma. This we should understand. This one, no, this big one, this one, this is called as basilar artery, and this artery, if it goes, patient goes into coma. There is no mercy after that. With partial basilar artery occlusion, there can be diplopia, visual loss, vertigo, ataxia, weakness. So many elderly face all these problems because the overall circulation in the brain starts coming down. In patients with hemiplegia of pontine origin, the eyes are often deviated to paralyzed side, whereas in patients with a hemispheric lesion, the eyes commonly deviate from hemiplegic side. When a small paramedian arteries arising from the basilar artery are occluded, contralateral hemiplegia and sensory deficit occur in association with ipsilateral cranial nerve palsy at the level of the lesion. So these are slightly more dangerous phenomenons, and very seldom people improve out of it. Okay, most of the cases they don't improve. Occlusion of any of the major cerebral arteries cause vertigo, giddiness, nausea, vomiting, nystagmus, ipsilateral limb ataxia, loss of balance. Okay, deafness also can happen due to cochlear infarction. So small blood vessels getting clogged, they lead to different kinds of weaknesses. Okay, and yes, so thank you very much for joining in. Brahma Muhurat Yoga Challenge. We are running it for last 1 year and almost 1 month now. Overall, the live stream is going on since last 1 year, 6 months. So please do practice regularly, like, comment, share, and subscribe. And yes, if you have any questions or queries, you can definitely reach out. So thank you very much. I request, like right now, 28 people are there. I request all of you that please bring at least one person to join Brahma Muhurat Yoga. So that is how within next 1 week, we should be having at least 60 people doing Brahma Muhurat Yoga together. Our goal is to reach up to 1 crore at least. When we reach up to that level, we will see what kind of electromagnetic changes will come in the atmosphere, and through that we will be able to establish world peace. Simple and very feasible way, because it is online. There is no need to meet each other. And another thing is that we all converge together to one goal, that is the achievement of Maharshi effect. And that Maharshi effect will be able to manifest when the numbers increase. The numbers are very important. One person, if one person is doing, that person has to do it for a long duration. When more number of people are doing together, then the time period for doing meditation comes down drastically. So thank you very much. Always remember that all of us have to be healthy, happy, and prosperous together. None of us should suffer. All of us have to live in harmony and peace along with all other plants and animals. Have a nice day.